participate in. We do this at the end of each of our RCR seminar series each year to try to make next year's presentation better for all the participants. So please log into live.boxvote.com on your phone, your tablet, or your laptop, and put in the pin you see on the screen, which is 99802. And also ask people who are not in JBJ, so folks uptown and at the Primate Center, please participate with us. First question, is Thursday a good day for the class based on your schedule? And if not, what day of the week is better?
The website.
Yes, live.boxvote.com. And for those of you in JBJ, and I guess everyone should be able to see this right down here, live.boxvote.com, and the pin is 99802. Sunday.
We appreciate the feedback because we incorporated it.
Okay, so I guess we will move on. Next question. Was 3 p.m. a good time of the day for this class? If not, what's a better time of a day given your schedule? All right, thank you. Moving on, number 3, downtown or uptown, which is more convenient for you?
I think
It's not working. I thought I hit start, but perhaps that was user error. Got it now? Mm-hmm. Thank you. Thanks for letting me know. What topics would you like to see us add to this series? So for those of you who wrote research, if anyone is willing to say, what about research in particular? Yes.
More elaboration on conducting like ethical research in international settings. Like,
okay.
Dr. Keating mentioned it a bit, but it'd be nice to maybe have an extra. So.
Okay, very good. And for those of you who may have put that, because it's a big word, so that means a lot of people mentioned it, if you're not comfortable saying that out loud, please email us, because we would really like to know more specifically what you would like to see. I have a stack of cards by the door, so please take a card and email me or call, either one. Which topics that we presented this year were most relevant for you? And we're going to have the opposite question in a minute, which was least relevant. So for now, we're trying to find out which of the 8 topics were the most relevant for you. Which of the topics that were presented this year were the least relevant for you? Why is that not a surprise?
I don't know if sex is a biological variable. Yeah.
Was using VoxVote helpful? Did you like it? Did you not like it? We just added it maybe last year. And so we're just wondering if people think it's a useful tool. And lastly, we're interested in any feedback you have. How can we improve the seminar series when we give it next time? Well, thank you. Coffee and snacks. We'll work on that for next time.
I swear. Oh, now it gets big.
Great coffee and snacks.
Snacks is getting bigger.
Should we go twice?
Okay. Well, thank you all for participating in our survey. We really appreciate it. And if you have comments that you would like to pass on to us directly, again, please email me, call me, come by and visit. We have cards by the door. So now for the topic for today, Dr. Tanette Krause-Wood is our speaker today. She plays many, many roles at Tulane. Among them are Professor of Medicine, Professor of Epidemiology in the School of Public Health and Tropical Medicine, Associate Provost for the Health Sciences and Senior Associate Dean, and she also leads the university's MD MPH program. She is and has been a PI and co-investigator on many federally funded grants, and she notably is currently the PI and research director of the NIH's Building Interdisciplinary Research Careers in Women's Health Career Development Grant. Her research interests are focused on clinical outcomes and healthcare processes for patients with chronic diseases such as hypertension and diabetes. Dr. Krause-Wood has more than 125 publications, including peer-reviewed articles, reports, and book chapters. She is president-elect and a fellow of the American College of Preventative Medicine and a fellow of the American Heart Association. Her national leadership positions have included standing member and chair of the NIH Study Section, Health Services Organization and Delivery, and a member of the NIH Center for Scientific Review Advisory Council. We're delighted that Dr. Krause-Wood is here today to talk with us about enhancing reproducibility through rigor and transparency, sex as a biological variable. Please welcome her.
is a nice full class this year. Do we have people from another campus connecting in?
We have people uptown
Uptown?
and at the Primate
Okay,
Center.
well, there you go. Well, it really is a pleasure to be here. Actually, last evening, we had several people from the Career Development Club come and hear a presentation talking about sex as a modifier of disease. Did anyone attend that? Okay, well, then you'll hear some things that sound similar, but perhaps in a little bit different way, but you'll get a different kind of credit for today's presentation. Thank you very much for your kind introduction, and I think relevant to today, because this whole topic has come forward as a result of the National Institutes of Health, my role as a reviewer, also serving as study section chair, and then also serving on the advisory council. You know, I've seen a lot of these aspects of what NIH wants, and what we want to make sure is that you all have a good understanding of why this is being required now for NIH. What are some things that you can do to make sure that you're covering this, and how you can begin to factor this aspect of considering sex and gender in your research as soon as possible if you're not already doing so. At the end of the day, we talked about the National Institutes of Health. The emphasis is on health. It's not the National Institutes of Research. So everything that we do needs to translate into improved health, right? And so for men and for women, and that's the particular focus of today. So I'm going to give you a little bit of background on the policy that the NIH set forward on SABV, or sex as a biological variable. We're going to talk about some of the evidence of differences by sex and gender for diseases, because it sort of brings the story home. We're going to talk about the NIH perspectives and guidance, some of the approaches to studying sex as a biological applied to women, to at different ages, to children, to men of different ages as well. And so therefore they were finding out the effectiveness and the efficacy that they were observing in clinical trials focused on middle-aged white men were not working in other groups, and it signaled a problem. We went from inclusion to the NIH focusing on the science of sex and gender, and now more recently to considering sex as a biological variable, an important component to consider in all aspects of research. The beginning of the inclusion came with the 1993 NIH Revitalization Act, which required inclusion of women and minorities into research. And then made sure that people, if they were doing clinical trials, you had to ensure that you had a rigorous enough design and a valid analysis to assess the different effects, and that you could not list in an NIH application that you were not including it. A reason for not including them could not be because it cost too much money. So that was taken off the table, and every section of NIH applications must include this section on inclusion for gender, minorities, and children. How many of you all have completed NIH grant applications? Okay, great. So you've kind of got some experience with that already. Those of you who haven't, it's coming to a theater near you soon. We hope. Okay, so after this Revitalization Act in 1993, which at the time, there were very few women in any of the clinical studies and clinical research that was being reported, you can see that in tracking over time, at the top that includes all studies, including those that are specific for women and men, you can see that over half the participants are women. If you look down at the studies here, where you're excluding male-only and female-only studies, you see we're about 50-50. That's about right, right? Our population's 50-50, so you would expect that the trials would have that. So the Revitalization Act, it worked. We saw an increase. You required it. People started to including them into studies, and we're seeing benefits of that and improvement in morbidity as well as improvement in mortality across the spectrum. Now, when we talk about sex and gender, and this is getting to be a very complex discussion at the presentation last night, in the middle of it, someone said, well, tell me how we're going to handle transgender. And the speaker said, well, just for the record, tonight we won't be able to tackle that. We won't be able to tackle it today either, because that adds in more complexities into what we're doing, but it's still very important aspects of what we must consider going forward. But if you just look at just basic definitions, sex is a biological construct. It's determined by the DNA, what's on those chromosomes, and it's derived, at birth. I mean, it's what people are born with. When you look at gender, this is more of a cultural concept. I mean, it is a cultural concept. And this is really more of a person's self-representation of what they do and who they are and what they want to be. So how sex and gender influence health and disease, it's important to consider these different implications and understand why we need to study this. If you're considering that sex is a biological classification, and it is, and you know that every cell in your body has a sex, then you understand that no matter what you're studying and what you're doing, trying to identify mechanisms, that sex may not, but may play an important role. Gender being this social construct, and knowing that this is how people not only perceive themselves, but how they act and interact with others, brings other layers to the role and responsibilities that we have in exploring sex and gender. Okay, so in various studies, in animal studies and in preclinical studies, when you're dealing with tissues and animals, you can know chromosomically and biologically what these tissues are, male or female. When you get into human studies, sex you can also determine by chromosome, but then you have the other aspect of it, which is gender, right, and how people represent themselves. And although they are distinct, they are intricately related, and so you have to understand as you're moving forward with your studies how you're going to be perceiving this. So knowing that both sex and gender have a profound influence on our lives, and it's not just physiologically, but also how it influences susceptibility to disease and response to treatment, it's interesting that oftentimes scientists have assumed that physiological processes are very similar, and yet data is emerging that would indicate that that's likely not the case. For example, sex-biased genes, and this was a topic that has been brought up by others. So we know that sex is in part determined by what the chromosome, composition is. You have sex, X and Y chromosomes, and we know the Y will determine the male, and double X determines the female. But we also know that in addition to that, many of the things that happen and the factors influencing development and disease and the rest of it deal with how the body responds to sex hormones. And so it takes both of those in influencing the development of sex-related diseases, as well as sex responses to things. So chromosomes, although they have the sex-specific aspects to them, right? As we just said with X and Y chromosomes, it's important to know that important factors that are caused by the ovarian and testicular hormones are also relevant. So when we're looking at sex and gender-based research, then it truly is beyond reproductive health. I mean, some of the reasons that are cited in the literature on why in the early years they only focused on middle-aged white men is because they were concerned that they didn't want to influence or disturb the reproductive health of women. They were responsible for bearing children, and that therefore if you were involved in clinical trials and something would happen, that might have adverse effect on offspring. The problem with that whole idea is that when women were pregnant or in childbearing years and they got sick or ill, you needed to treat them, and yet you had no idea how they would respond because they had not been tested in women. But there are many, although there are aspects of what we do and influences of health that are related to reproductive health, there are also many things that are unrelated to reproduction. So what are we missing by not including sex and gender in investigations or at various levels? And what harm are we doing by not including sex and gender in investigations at all these different levels? So there's a lot that we may be missing. I don't know if I mentioned it in the very beginning of this, but the slides have been so beautifully prepared by the NIH, and I've credited them because they provided a wonderful overview of how to present this information and educate the scientific community about it. So if we were to look at just a few things about sex versus gender, and we're not going to read through all of this, but if we look at one example, let's say cardiovascular risk. You look at just the sex-specific, the biological construct that we're talking about. You would know that women, with respect to their cardiovascular vessels, their blood vessels, they're typically smaller, and they have more branches, more intricate branching than what you will see in men. So when you're talking about, addressing women or doing angioplasty in women, and yet the stents initially were tested on men, oftentimes women had adverse effects from being treated with angioplasty because the stents were too large. Their vessels were too small, the disease was diffuse, and it didn't work as well. So there was increased mortality, increased adverse events from initially treating women, just based on the biological construct and the differences in men versus women. But then if you look at gender, there's some other aspects that increase or influence cardiovascular risk. And that is women, especially middle-aged women, who have a lot of their family oriented. And I say that men are not family oriented, but in many cases, the women are the primary caregivers. They're the ones taking care of the family, coordinating everything, and oftentimes do not put their health first. They are delay going to the doctor, and they present differently with symptoms, and so therefore their access to care that might decrease their cardiovascular risk is different based on their roles that they perceive as women and caretakers in their family. So you can see some differences with respect to gender that are distinct from what there is biological. So if we were to look at some other examples that we have here, so let's say, for example, arrhythmia. Sex and gender differences are known to affect the heart rhythms. So there are these two drugs here, Seldane and Propulsid, that can trigger potentially fatal heart arrhythmias more often in women than in men. Probably don't want to use those in women because they don't work the same. They have different effects. Women are more likely than men to have complications from implantable cardiac defibrillators. Women are more likely than men to experience surgical complications, some of the ones I just described to you earlier, and more likely to have atrial flutter after they have ablation therapy. So real differences between this. And in some cases, these types of observations have driven differences in treatment for women who perhaps should have been treated but were not treated because of fears that they may have a different reaction to treatments. For cardiovascular risk, we know it differs among women versus men. For one, cholesterol plaques are really present themselves quite differently in women than in men. For women, they spread evenly throughout the artery wall, giving you this diffuse disease. And I'll show you a picture of that in just a minute. For women, the effects of aspirin are different than they are on men. They both have some beneficial effects, but for women, they're good for reducing your risk of stroke, and for men, reducing the risk of heart attack. So the guidelines are not the same for women versus men in taking aspirin, depending on what your other background and baseline risk factors are. And also, just knowing that cholesterol levels vary greatly over menstrual cycle. So there are differences. When we looked at cardiovascular disease, and this is what I was showing you a little bit more typical for women, is this diffuse disease with multiple branching and smaller vessels that go through. These do not respond well to angioplasty, these types of lesions. They do increase your cardiovascular risk, but they don't respond well to therapy. Whereas if you're looking at where many men typically present, a single segmental stenosis right here, that responds very well to angioplasty. You can go in, slip in a stent, open it up, and see beneficial effects. In the brain, again, we see differences in men versus women, looking at humans and non-human primates, as well as looking at rodents with respect to the gene expression and the influence of the aging on that gene expression. You also see in the rodent models, and we suspect it may be somewhat similar in humans, is that brain cells die differently in men versus women. And of course, that has incredible implications in the treatment of the disease. So as a result of a lot of this and looking at what was happening in the literature, Janine Clayton, and she's the director of the Office of Research in Women's Health and a strong proponent of the Birch program, which I'm very proud to be a part of. And Francis Collins came out with a statement in Nature on NIH to balance sex and cell and animal studies. What they found was that they reported, yes, we're doing quite well in the clinical studies. We're identifying this and addressing it on the clinical, and we're engaging women and men in equal proportions, but we're still not advancing health and the technologies in ways that we want to be able to do because we don't understand the mechanisms, and in part because we don't have enough on the basic science realm that would understanding sex differences that would help it. So they came out and said, now we want more attention to sex and sex differences at the basic science and the animal level. Okay, and part of this was based on the fact that there's dramatic underreporting of sex for animal studies, and although it has improved over time from this being none to people reporting, only about 53% of the studies that are reported in the basic science actually include the sex of the animal. They say maybe they don't have gender, although Frank Marvajarva says that maybe they do. He's starting to see that the animals do respond differently to their roles, but usually we refer to animals as having sex only. So males still dominate in the animal studies. We assume that that's the case, and all of these major journals have reported such, where it's 5-to-1 in many cases for male to female studies, and in many cases people haven't even reported what the sex of the animals are, but most cases they are male. Here, when they looked at just animal studies and surgical research, they evaluated all the publications over a 2-year period, and they identified 618 articles which had animals and cells. And it was interesting that even for female prevalent diseases, that only 12% of the studies studied female animals. And they have other studies of this where they found diseases that are only for women, and yet all the basic science research were done in male animals. Doesn't likely going to help you lead to therapies that are going to improve health across men and women. So the NIH in 2014-15 said, we're going to begin to study strength. We're going to start to require this to strengthen science. And they're going to do this over this thing where you know that there's a problem that is creating gaps in our knowledge. The solution is now that sex is going to have to be considered throughout the spectrum of research. And the action is requiring deliberate approach within grant applications that are going to be funding to include men and women where appropriate, okay, in order to get the full benefit. And the ultimate outcome are going to be more rigorous studies that are going to advance medicine and improve health. So if you look at the guide that came out in 2015, they said the things that we're going to be doing in reproducing rigor and reproducibility. You've already had this at the last presentation with Dr. Steele, but scientific premise, the rigorous experimental design, and of course you see the third one is consideration of relevant biological variables such as sex. Of course there are others as well. And then lastly, authentication of key biological variables, which we won't talk about today. This is where we're focusing. So this is what came out, the requirement. And of course, the whole goal of NIH is inclusion was great in clinical studies, reporting that your sex of your animals or your sex of the tissues that you were studying, important. But now we really need to go beyond inclusion and look at what the effects are on health. So starting with the basic science of the preclinical studies, moving across the toxicology and safety into your clinical trials that ultimately give you your sex-specific data that can lead to improved education and health policy. And then these can inform more preclinical studies as we find out what works and what doesn't work. When they're talking about this, there are two phases, two primary phases when you're looking at research. And one is the whole concept of discovery. And that is our basic science, as well as the basic research in which you were looking at cells, subcellular, and in some cases, animal studies. But again, as I mentioned, the whole focus of NIH is turning discovery into health and improved health in particular through the preclinical, the translational, the clinical research, and then healthcare and ultimately population research. You're going from having less data and how it works in some, perhaps more simple organs into the very complex process of rolling this out into the community. So very important that this work be done. And they not only consider sex and gender as an important a biological variable, an important role, but also reporting it. This is an example that you may have seen, and I have seen this in my own research when I have looked at an effect. So here, let's say we're looking at the impact of disease of a particular treatment. And here, if the treatment is in yellow and the control is in purple, you would say that here that the treatment had an adverse effect on the disease. Higher, just say in that situation. Overall, say, well, okay, it's not good for anybody. We ought to get rid of this. But when they disaggregated it and look at male versus female, what you see is a negative impact of this treatment. And in this case, this has to do with PJ34 for ischemic onset reduction and looking at myocardial infarcts. But here you see the adverse effect was driven by what was happening in women. But if you look at men, there actually was a beneficial effect of the treatment. We would have missed that benefit for men by just looking at it in aggregate. And there are many examples like this where, in my research, we looked at relationships between complementary alternative medicine use and its in negative impact on medication adherence. We found overall there was an effect, and we said, okay, well, that must be for everybody. But when we dove in deeper, where that whole relationship was driven by, African American men were using complementary alternative medicine, and that was impacting their low adherence. Driving education programs to help other people and women to increase or decrease their use of complementary alternative would have had no effect at all. We would have wasted time and resources. So this goes into different areas. So based on this, the NIH made this a priority to enhance the reproducibility of research and to make sure that we're looking at not only inclusion of sex and gender, but also looking at the effect of sex differences where it's appropriate. So if we're to, I don't know if this will work, let's see.
It's incredibly important to consider sex as a basic biological variable in research because, well, half our population is of one sex or another sex. And we know from the science that there are many developmental aspects that influence biology according to sex. There are many life circumstances that influence biology according to sex, and there are changes in biology over a lifetime that influence our response to diseases and our response to life circumstances according to sex. So it's really important to consider sex. It's just a basic biological variable. You need to ask yourself, do you want to study only females? Is your question more appropriate only for males? You need to ask yourself if you're going to study females or include females. Do you want to study females in their reproductive life, or do you want to study them in reproductive senescence? And of course, rodents have something called reproductive senescence, which is actually not the same at all as human menopause. So if you're thinking about wanting to make your experiment relate to a human condition, you then have to ask yourself, is this the appropriate model? In order to think about the inclusion of females and males in animal work, we need to revisit some of our tried and true scientific assumptions. So one scientific assumption is that you don't report negative data. It's coming up over and over again in this meeting, this workshop, that we need to report negative data. We need to know when there isn't a difference as well as when there is a difference. And we need to understand the conditions under which the negative difference or the positive difference occurred. So a familiarity with the nuances of both the model you want to work with, what the animals themselves do, and also a familiarity with the nuances of hormones. I think A lot of people think that a hormone is a hormone is a hormone, but of course there's 17-beta estradiol, there's estrone, there's estriol. The question is, which are you going to study? Are you going to study them opposed with progesterones? Are you going to study them opposed with synthetic progestogens? What is going to happen? So it is complex, but there are many good review papers out there now because the field has been developing, I think, strategically with an eye toward this moment when the NIH, the Canadian Institutes of Health Research, and the European Union would begin to demand for the good of science that investigators begin to include males and females in their models. There isn't any condition in which this actually won't be important, but I think Alzheimer's disease is an incredibly important condition in this regard, and because Alzheimer's disease is a multifactorial disease unless you're studying early onset, and early onset only affects a very small proportion of people. So we know, for example, in men that traumatic head injury, risk that comes from risk-taking behavior that's more common in men than women, that this is a risk factor for Alzheimer's disease. We know that stroke, which is more common in men than women, at least prior to menopause in women, that stroke is a risk factor for Alzheimer's disease in men. But we also know in women that it looks like actually having your ovaries removed before natural menopause is a risk factor for Alzheimer's disease, and that's a very gendered condition.
How many of you are doing basic science research, animal cell tissue? How many clinical? So they're more basic than they are clinical, but even though she's talking more about this preclinical and working in this, the concepts that she's bringing up are important. You have to know your model. You have to know which group, whether it's the animal model or whether it's which group of humans do you go into. You have to think about this and understand that there may be not only just these biological differences, but cultural engagement of people like the men who do more risky behaviors involved in sports with traumatic brain injury and how this might impact their onset of Alzheimer's disease at some other time. So important to consider these different aspects. And this was from a workshop. All the videos are online. You can look at more of them. It just sort of brings that story home and gives you some more examples that you may find useful. So as a result of all of this, the NIH has come forward with application language and is now requiring that in the research strategy of your grant application, the expectations is that you explain any of the relevant biological variables. Now, sex is one of them. Might also include, other aspects of health, height, weight, whatever, the other biological variables that make it important, but you want to make sure that it is included as appropriate in your design. And if it isn't, then you need to have a strong justification for why it is not. And so that's going to be an important aspect of what we do. So how do we get there? What's the goal? So the way that Janine Clayton and her crew outlined this is looking at the 4 C's of studying sex to strengthen science. And they are as follows. First, you need to consider that, sex as a biological variable and look at it in your design. Second, you need to be collecting the information, collecting the data and being able to tabulate it. Third is to characterize the data by doing an analysis and understanding if there are and are not differences. The basic science certainly has historically not published a lot of negative studies, but we do the same thing in clinical research as well. It's harder to get a negative or a null finding published. Everyone says, well, maybe you did something wrong, or maybe it wasn't a large enough sample size, so therefore it's not worth publishing. But not having that data means someone else is going to repeat some of the same mistakes or waste resources when they could have built on those negative studies. And then lastly, communicate. The results have to be reported and disseminated through peer-reviewed publications, peer-reviewed presentations, and communicated about what these results are. And so that's important to do. So what does it mean to consider it as a biological variable? Things that you need to do. The first thing to do, the lowest hanging fruit, is to do a literature review and see if you can find evidence that there is a sex difference or lack of a sex difference in the area that you are researching. And even if you're in clinical or you're in basic science, it doesn't matter. Check out the literature and look across the field. because that may give you insight into what you may need to look into. So check out the literature. Based on that, you can formulate a research question that, if appropriate, may include sex or sex differences. Incorporate or plan to incorporate males and females into your study design, right? Especially if you find that there's relevance, or if people have not determined if there is an effect because no one's looked at it. That gives you an innovative, inroad into that research. If you are not including men and women or males and females, then you have to have a strong justification, and we'll go over some of the reasons that may be considered a strong justification. For example, you need to include large pool, you don't include women in a study of prostate cancer, right? Unless, of course, you're dealing with some transgender issues that may be important, and then you may have to explore that. But for the most part, that would be a reasonable justification. I justify all the time focusing on adults with hypertension because hypertension hasn't been a highly prevalent disease in children, although with the increasing obesity and salt intake, it's becoming more of an issue every day. So consideration of the influence in the study design. If you're doing clinical trials, consider stratified randomization so that you can include equal numbers of men and women in your treatment and control groups. Characterization of the study results will be important, and looking at the tables where you can report in aggregate, and then you can report your data by sex, and that's important. Some cases you may not have a sufficient sample size to detect sex differences, but you can report the information that later may be used in a meta-analysis, and one of you may be doing it. Looking at where aggregating results across the grade. So you can look at the treatment effects, consider the influence across your study design, and make sure that you have an appropriate generalization of your research findings. And if you can't generalize, then you need to list it as a limitation. Okay? So these are the types of things that you need to consider as you're planning your research and including this. For preclinical studies, it's a similar type of strategy where you can do a literature search first, and if you find sex-skewed disease prevalence, then you can begin to explore in your mind about what you think those underlying premises are, physiological consequences. You can include males and females in the test groups as you design them. Certainly report on any sex-based data that you get, and conduct pilot studies to actually explore if it makes a difference. So for basic science, this is important, and it's relatively easy for you to randomly assign the animals or put them in their groups and not worry about the differences. In humans, it can take a little more effort to make sure that you do this, but it's important nonetheless. So there was a lot of anxiety over this when it first came out. And many, particularly in the basic science, were saying, well, my gosh, you're going to make me double my sample size. It's going to cost the NIH ginormous amounts of money. I'm not powered to look for sex differences. Well, NIH is very clever in many respects, and I think they've relied well on the ingenuity of their investigators to figure it out. I've heard that on several of my NIH grant applications when they put in new rules, and I call them and I say, will you give me some clarity about what it is you want? I said, we're not really sure, but we figured if we threw it out to you all, you'd figure it out. And that's exactly the truth. Anyway, it worked out. We got the grant, so I'm okay with that, but you never know. But in this case, NIH is very careful to say it's not just, including sex as a biological variable is not the same as, examining sex differences. And they're not mandating that you absolutely have to look for sex differences at every venture. And as a matter of fact, they're careful to say they're not going to require any specific research design. Leave it to the investigators. People, they figure it out. They're smart, and they'll tell us exactly how it has to go. So this is the good and the bad news, because you're looking for a little more guidance on what exactly do you want, because I can check that box, But in many respects, it's a good thing because it gives you some flexibility on how you want to build it. So as you're thinking about this, certainly develop a data analysis plan. After you've done your literature review and you realize that this is something you need to explore, it's a disease that affects men and women, and therefore, you can do this and you can make your appropriate design for your study and as well as your analysis plan. Do report the results, whether you do or do not find differences, but definitely include them. And some of the reasons that people can give as considered strong justification for not including both sexes is that, and we don't get away with this in the clinical research because they've already said you can't say cost is an issue. You have to include them in clinical research. But in the basic science, they can say that it's an acutely scarce resources for whatever. That's one of the ones they list on the NIH site. It's a sex-specific condition. That's a great one to use if that's what it is. Or that this is a research where the study of one sex is scientifically appropriate and justified. So, you may be, looking for reasons for how you might justify it, but just make sure that you include it. NIH also realizes, and this is from the Center of Scientific Review, that this can be very challenging because the investigators and the PIs are really waffling and debating among themselves about what is convention versus what is good science. And the NIH is saying, although you may have been doing it this way forever and it seemed like we were doing pretty good, the best science we believe now is going to be by focusing and making sure that we're including women and men across the spectrum. What is the adequate incorporation of sex in a study design? Questions people ask, how many is enough? What's going to be it? What am I going to dilute down my findings because I now have too much physiological variability amongst the sexes? So, in a situation where the disease is focused predominantly on one sex, a single sex study may be more appropriate. You just need to make sure you've thought it through and have that ready. Reporting is very important, whether these be preclinical studies, where you want to make sure that the sex of the animal at least is reported. It's amazing to me how many didn't even report the sex of the animal, so you didn't know what you were really looking at. And how you would go through, many are now, they call them the Sager guidelines I saw in the thing. Has anyone heard of those? Sex and Gender Equity Research Guidelines that started on an international thing, a beautiful article, and it came down to one little table about what they were expecting. One, that you include in your title, if it's a single sex study, that in your abstract you indicate sex and gender, inclusion somehow, that you explain why that would be significant somewhere in your introduction, that your methods show a clear design on how you incorporated sex and gender. Okay, and that your results that you report, what you found, even if you weren't powered to assess sex differences, you can still report what you found by gender in a table, and ultimately this may be used for other places. So clinical studies also, you need to make sure that you're including this and including it in the papers and the presentations that you make through tables, reports, your methods. And also with, they're recommending the same thing here with title and abstract should include it. Make sure your study design, et cetera, is in line with this type of reporting. So for NIH grant applications, when they came out with the guide notes, which I showed you, that was in 2015, they said these were the 4 constructs that would increase the rigor and reproducibility of research. Too many times the studies, and there are some other charts that I didn't show you, where they showed in the preclinical studies that these drugs were highly efficacious. And when they applied them in humans, not only were several of them not efficacious, they were actually detrimental. And in part, they were not able to reproduce the results that they found in these preclinical studies testing these drugs. They could not reproduce them. And so there's concerns about that for the NIH because they've invested a lot in this area. So by getting at these 4 constructs, this is one way that they plan to improve it. If you look at the required elements, okay, so they're here: premise, scientific rigor, sex is a biological variable, and the authentication of key biological variables. You can see the section of the application where sex is a biological variable is required. It's in the research strategy, and in particular, it's in the approach. The important thing for you to know is when it goes into scoring, does it contribute to the overall impact score? And the answer is yes. So during the review, that will be asked, have they addressed sex as a biological variable? Doesn't mean you have to answer the question, but have you considered it and given it? So the guidance that the reviewers are given when they're reviewing your application, and this is just important for you to think about as you're planning, if you were, and just guidelines, but if you were here, one of the first questions, does the study involve vertebrate animals or humans? And if they do, the expectation is that you're looking at sex differences. Okay, so if the answer is yes, the next question is, are they intended to test for sex differences? You don't have to, but if yes, then you want to make sure that that it's appropriately designed, and if it is appropriately designed, that the reviewers should list this as a strength of the application. If it's not, then it should be listed as a weakness. And you know the strengths and weaknesses define your score. So if the answer is no, that they're not designed to test for sex differences, because the NIH does not mandate you have to look for sex differences. They do not mandate that, but they are asking that you at least include males and females if it's appropriate and relevant. And so if it's yes, then the question follows up is whether or not you have the appropriate design. Do you have enough numbers? Is that correct? And if yes, it should be listed as a strength, and if no, it should be listed as a weakness. If the answer is no, that both groups are not, then the reviewers are prompted to be asking themselves, is there strong justification for not including both sexes? Okay, and if the answer is yes, then that's a strength, and if it's no, it's considered a weakness. Okay, now many people will tell you, I don't know, maybe it's because I'm a Birch PI and because all of my research includes tables stratified by sex and race, and we published in that area. And of course, I'm the presenter today. So and when I go and I do my NIH reviews, you better believe I'm looking at sex as a biological variable, and that I'm looking that people have represented it in their grant applications. Although when I talk to some of my other colleagues in other areas, it's the reviewers don't know what to do with this. They can give me this chart all day long. They don't know what to do with it. So they're just looking to see, did they include males and females or whatever. So there's a lot of variability on how much attention is being given to this. But what I will tell you is it is a requirement of the NIH. I do believe that this is going to contribute to better science. It's going to advance all of our fields, right? And that this is going to lead to things that perhaps give you an innovative hook when you submit your research if others have not looked at sex differences or gender differences in their research. And many are finding that they're adding it as a secondary aim to their studies. They're getting supplements to study it, and there are pots of money that allow for that as well. So important thing to think about. These are the instructions that are given. I just got a whole list of these for the study section I'm working on in November. And of course, you can see the instructions here where they're telling the reviewers, do they have adequate plans to address relevant biological variables such as sex? Okay, so we're asked to do that when we're evaluating and writing up our things. So there are a lot of resources, a lot of things. There are a lot of policies and resources that are out there. Again, I'm not going to even try to type these things in. Just go Google it, and they all pop up. But you'll see that there are a lot of review documents, guidelines that are out there, resources, training webinars, videos, a lot of things that you can watch, both for clinical and a lot on the basic science, because this was the area that they were most concerned about given the underreporting of the gender. There's also the Office of Research on Women's Health has an A to Z guide looking at sex and gender influences on health. So if you're looking for ideas or you're trying to see what others have actually looked at in the area of research that you're interested in, this is a great place to go. And it's nice to know that there's this online sex and gender course that you can take by going to this site, and it'll go through, the different aspects of sex and gender from the basics of clinical research. So it would be a good thing in the copious amounts of free time I'm sure you all have to go do some additional training. So in conclusion, the study of sex and gender is important and will increase our understanding of human physiology and function, and ultimately will lead to advances in the way we deliver healthcare and improve health across the nation. The sex bias factors can cause sexual bias in gene expression throughout the genome, so understand that that's the influence of sex hormones, and understanding how that plays a role will be important in both the basic and the clinical realm. Researchers really must consider the impact of sex and gender on the interpretation of their experimental results, and note that this really does extend far beyond reproductive health and includes, a focus on just health. And so now that's tremendous focus of the NIH. I think that's it. Are there any questions for me?
You mentioned that this should be addressed in the approach section of the NIH grant, or it's a separate?
The approach section. So, in the approach, and anybody who submitted grants to the NIH knows that, you may score well on significance, you score well on innovation, and where most NIH scores go down, it's in the approach, which is where you're telling people exactly how you're going to do it. So to me, it's the most important section of an NIH grant application. I mean, you have to have everything, but that's the one that's more important. So it goes there where you describe the methods you're going to use, your study design, your sample size, and your analytic plan. Okay, other questions? Oh, it's just too exciting for words, isn't it? I know. Okay. Well, thank you all very much. Lots of research.